All right, everybody, we're here with another Alovéa Pros, and I am super excited for this one because we're going all the way to Woodbury, Minnesota, which oddly enough, I'm flying to tomorrow of all things. But Tara, we finally are together for a podcast. How are
I
you
know.
today?
I'm good. Thanks, Craig.
Yeah,
Welcome to
it's
Minnesota tomorrow. Yeah.
yeah, exactly. Well, do you guys have snow yet?
No, it's just gloomy. It's actually pretty nice for fall, for late October here, so I'm not complaining. But no snow, just a little gloomy.
All right, still got the color on the trees.
Still got the color in the trees.
I'm excited to get up there. So, well, I know we've been kind of going back and forth to try to get this podcast put together. And I'm really excited because I think you do one of those. It's like there's the few jobs in the world that are probably the most important things around the world that don't get the financial kind of benefit that you think they would and how critical it is, as well as, probably the full understanding and respect that people should have around it. And, I think of like teachers around this as well, but nurses have to be at the front of the line when it comes to this and first responders and things like that. And I've always been amazed on people like you have chosen to choose this to do in your life. And I'd love to hear the story. Like, how did you get into nursing and when did you get into nursing and what do you love about it?
Well, it's actually started super early. I was 16 and my parents said, you have to get a job. And I'm like, I don't know where to work. And my mom said, I think you'd be a good nurse someday. So go apply up at the nursing home. There was one nursing home in Woodbury at the time. I'm like, oh, so whatever. I went and applied. And my very first job was serving food to the residents in long term care, assisted living. 2 years later, I did apply to nursing school, got in, and I thought I actually really like older people too. I like the elderly. It wasn't very common. A lot of people love the hustle bustle of the hospital, but got my 4 year degree, went into the hospital setting to get some experience. And about 2 years in, I thought, I want to do more with my degree. And at that time, the nurse practitioner program at the University of Minnesota it had been up and running since the 80s, but only had a few programs to offer. And one of them was a geriatric nurse practitioner. So I went back to
Wow.
school. And you could pick psych, adult, gero, and uh, pediatrics. And like, nope, babies and kids are not my gig. Older people are. So went into geriatrics, and I have been doing that ever since. And I just love it. Usually it's nursing home type of work. And yeah, but those residents and the people there are just amazing. They fill my bucket. That's how I got into it. My mom was right. At 16, she said, you'd be a good nurse. You're pretty empathetic.
So you have told your mom that you did say, all right, you,
Yes.
you, you nailed
She
this.
herself, if she listens to this, she will want to be
Well,
tagged in.
that is so funny. But I think, it's a really special person because both my wife and I, her mother and my father are both in long term, or my mother, sorry, both of our mothers are in long term care. And we just got back from visiting. And I think we often leave there, and I hope everybody does, in talking about what a special human being it takes. Because I think one is, there is a beauty and a wisdom in our aging elderly population that they also don't get that kind of connection. A lot of other cultures around the world really put that at a different level than maybe we're so busy here. It seems like in North America, we're forgetting the wisdom and the importance of that. And but there's got to be a lot of difficult days too, because we go in there and we just think there's a beauty to it, but also there's a lot going on. I mean, what do you find are some of the biggest, like, what are the challenges that you face that you'd love for people to know about?
Yeah, I think the biggest challenge is usually staffing. Nurses know, and nursing assistants, therapists. I think we all would make more money going into the hospital setting. We know that, but they are a special kind of people that choose to work on the inside of the brick and mortar long-term care kind of facilities. So staffing's always hard. I mean, so many times I'd be rounding with the doctor and I'd help somebody off the toilet or I'd help them brush their teeth because there's just one nurse to 20 patients. And so that can get a little sad to see that, but they do a really good job of training the staff and, really empowering them that, these people live here. This is their home and making it as homey as possible. But I think just the staffing challenge has been the number one. Some nursing homes get bad raps if they're older, some are private pay, and they look like somewhere I would actually live now with like movie theaters and bars. And you're like, what? This is a nursing home? But I've rounded at, gosh, well, probably over 200 in the state of Minnesota. So
Oh, wow.
Yeah. And then there's some patients with lots of family involvement, and there's some patients with no family involvement.
Yeah.
So that's always kind of
You get a little
sad.
bit of all of it. Well, and it's interesting too, right? With the aging population, with the baby boomers,
Yeah.
the growth of the demand of that space is going to grow, but it's not just about the facility. It's about the people to help make the facility. And we do a lot in the world of hospitality and invest and have a bunch of hospitality companies. And there is something about this word that hospitality goes into every industry, because every time we go into the long-term care facility, it feels like the team members, the staff working there, they just, it's nice to see you. And, they're
Yeah.
always just so joyful, and they're working in a very different environment where even their patients leave because they're at that age where they're not sticking
Right.
around for a long time. Right. And
Right.
I've
Right.
always been amazed. So now I get to speak to somebody who does this for a living. I'm kind of blown away. So thank you for what you do.
Yeah. You are welcome. It really does fill my bucket.
Oh, that's beautiful. Well,
Yeah.
tell me about, so you've got this, you've been doing this for what, 20 plus years. You've got all the accreditation around this, but you're also sponsored Alovéa Pro. You got connected to this company. Walk me through, like, how did that actually happen?
So back when I was getting my master's degree, I almost got a minor at the U of M, and it was called Complementary and Alternative Therapies. And just Western medicine is great, but I was always interested in other things and oils and essential oils and aromatherapy and all acupuncture, all those things. Did not end up getting a minor in that, but throughout my career, just would kind of incorporate that in my own life. Like I had my husband and I had some infertility issues. I was doing acupuncture on top of some Western medicine things. But I had met Mindy Hockadal.
Oh, yeah.
Yeah, so we go back far. And I knew her when she was at the height of her Lyme's. And she was, and she knew I was a nurse practitioner. So she would ask me lots of medical questions. And then we kind of lost touch. COVID hit. And then she had found this Alovéa, and I just couldn't believe the difference of how she is today versus when I knew her. And so I'm like, okay, give me some more information. So she slowly introduced me to the product. And so then I bought some. And yeah, I use it with I actually used it on my dog's gums when he had a degloving injury that wasn't healing. And I rubbed it with some aloe on it, the immune, and it healed up. They were going to do surgery on him, but didn't need surgery. So
I just want to make sure I heard this right. You did say your dog.
my dog, I know.
Okay. All right. I just want to make sure I've heard that properly.
And a degloving accident is very rare in the human world. It's usually when you get in an accident and the skin, like you get degloved, and it's usually emergency.
Should I even ask how this happened?
Well, I'm going to tell you because no, he he's got his mouth stuck in a ball, and he must have somehow pulled it back. And the next day, his gum was like hanging down here, and it took 3 vets to finally be like, oh my gosh, she goes, we've studied this, we've read about this. I've never seen a degloving injury in a dog, but we're going to need to surgically pull it back up. So anyway, between the referral to a dog oral surgeon, which I didn't even know, but I called Mindy, and I'm like, I'm going to open these capsules and I'm going to put it on there. And I'm not kidding. He's completely normal. No surgery. So,
Wow. You know,
and then yeah,
it's interesting because I mean, I've heard so many stories with people using Alovéa products with their dogs, ours included. We had a 15-and-a-half-year-old golden doodle who left us exactly 6 months ago today, right about this time. So unfortunately, but he lived on our limitless immune. But I can say I know so many people, their dogs got into so many troubles and problems and all crazy things that dogs do. I've never heard this story ever before.
yes, I spread it around. It was amazing how it healed. And then I just noticed, it's really hard to get into doctors. It's really hard to get into clinics. Since COVID, if you're a doctor that could retire, you're retiring. Like primary care is suffering. Everyone's waiting months and months to get into specialists. And I've just had this calling on my heart. Like, I wish I could blend my Western medicine knowledge with something that helps people and serving of the kids and faith. Faith is very big in my life. And I know Mindy shares that too. And this product just seemed to kind of hit all of those elements, because I do get pinged people that know I'm a nurse practitioner that are trying to sell a peptide here or something here. They want me to be on their pro staff too, but this one just kind of hit everything for me. So
Well, it's so interesting too, because I've done a podcast with Mindy and she's amazing. And I've only seen Mindy on this side, which to me is just like this purely energetic and inspiring human being. And she tells this story, but you can only like hear it. And then I just did a podcast with the doctor that she was working with, and he kind of
Yep.
talked about the same thing. So it's pretty amazing when you see it from somebody you know. But
Right.
as a nurse practitioner, like you've obviously interested in different ways to take care of your health, different ways, not only through Western medicine, but also like you talked about Eastern medicine. When you saw this happen with your dog, it's hard to placebo a dog, right? So, I mean, how much of an impact did that have you on your scientific brain of thinking, like as a nurse practitioner, going, "Wait a second, like what? How
Yeah.
did that make you feel?"
Yeah, I was like, oh my, it was like a eureka moment. I did take before and after pictures, and I kind of went rogue because Mindy's like, let me send you what we have on research on animals. And I'm like, well, okay, I kind of read through it, but I'm like, well, this can't hurt him. Like it can't, if he needs surgery still, we'll get him surgery, but it can only help him. And that's kind of the motto that I tell people. Like, I have friends who have diabetes and have a wound on their leg, or I have my mother-in-law has multiple sclerosis. Like there's these things can't hurt you, so why not add it in? And here's the testimonies and the research and behind it. So it's a pretty easy sell when you know someone like Mindy or my dog. But I've listened to other personal stories of people, and I think a man told the story of his wife who lived 25 years longer than expected. She had really severe diabetes. I mean, those are my patients that I'm prescribing more insulin to, and more insulin, and here's another drug, and here's another drug. I mean, the elderly are on lists of meds, right? And it's on our duty to try to get as many meds off of them. And so if we can incorporate some of this into that, I bet we could.
Well, it's amazing too because if you like what you're talking about is like our entire platform of Alovéa products is based on food-based technology. Like it's just food. It's patent process of extracting the critical ingredients like the betalain out of beets or things like that. Basically we're just feeding people, but in a really, really good way.
Yeah.
Right. I've never
Well,
thought of that way until I talked to you, until you just brought that
yeah,
up.
yeah. No, that's a good way of putting it. I was just telling a group of friends last night we went out with about the story of the orphanage where they had like 15 children die in the orphanage, and then
Mhm.
gave them, I think it was immune for a year, and they had no deaths. I mean, that's
It's
amazing. They
kind
were
of
like,
eye
oh,
opening, right? It's pretty
yeah,
amazing. Yeah, it shows that the body's powerful if you're putting the right things into it, and keeping the bad things out too. We always encourage with Aloe like, maybe walk a little bit more and drink more water and all the right kind of things. But it's amazing what can happen. So, but you have this credibility. You like you said, you have people reach out to you. You could have just used the products. You could have just used them for your family. You could use them for your dog. Didn't mean you had to become a sponsored pro, right? Being an Aloe Pro, we sponsor coaches, trainers, athletes, and healthcare professionals. What was the reason you thought, you know what, I'm willing to put my name and credibility? What were some of the things that you said I'm willing to do that with this company?
I think I prayed a lot about it, and so that's one of my top things is just my faith is number one, and I just feel like this product is based on that as well. The serving the kids, buy one, give one, I think is the motto, but you can't like that. I haven't seen that for any other things over the years that people have wanted me to sponsor. And then just, I mean, we can't keep up with all the stories and testimonies of how it's helping people. And I'm really truly having people in my primary care practice ask about some of this stuff. They don't always know the name, but it's getting really hard to pay for meds and buy meds and insurance. And so this is like kind of all coming together. I've always thought functional health is something I really want to do too, and I might pursue a certificate in that. But in the meantime, this is it's kind of meeting all the needs that I was looking for in a product.
Well, and I loved what you just talked about there too, that you can have all like the right products, right? Because even in the functional world of health, you're still needing tools to give to your clients or your patients that they can take home and add into their daily life. So you need something simple, that's something that works. I know Mindy's story was like she loved the taste right away. Like there are some
Right.
people that my wife can taste something that's horrible for you, but or horrible tasting, but good for you, and she'll take it because like she really is great at
Like,
connecting to your health. I want to live a healthier life, but if it doesn't taste good,
yeah.
like I can't do it. So at least there's that confidence. But you also talked about the nourishing of the kids. The company is just now distributed 62.5 million as the time of this podcast servings of that same Ace Mannan that basically used for your dog and used for your family and your clients. Like, that's pretty powerful to know that that's going to kids around the world, and that's the product that impacted those kids. So that was a big part of your decision as well, and that kind of connection to your faith.
Yes, because I've always thought I really want to do a global mission. I want to go, help kids and life kids and all the excuses, right? And then I thought, well, this is a way to help without me physically going and moving my family to, I don't know, Tanzania or somewhere to help them. But like, this is a way I can even check that box off of wanting to help people, especially kids all over the world. So, yeah.
Well, and I think for people listening to this podcast too, what's neat is that the company actually brings people where you can sign up and pay for it and go on 2 trips a year with the former president of Mexico and his wife, and in Mexico, where you visit some of these orphanages, you meet some of the hospitals where the product's being integrated. And there's not too many companies that do that as well, which is pretty amazing. So we'll have to coordinate to make sure when
Yes,
you guys have to go on your Mexico trip so you can have that
I will
experience.
go. Yes, I will go anytime.
All right. Well, we'll tell Mindy. She'll have to join you on that one. But okay, last question to wrap it up
Yeah.
with. So, people are listening. Maybe they don't know about the products. If you were to say if I was your patient here and I wanted to live a healthier life, what would be the first couple products, or what would be the way you would be recommending for me to get started with the Alovéa products?
For me, and this is me, I swear by the Immune and Limitless. Those are just my two that I started with. And then, the drinks and the focus and the other things. But those are the two that I hands down would just say incorporate immediately. And that's kind of talked to Mindy about, not throwing everything at everyone, like all the products, right? You don't need to buy all the products, but almost like writing a prescription, like what are you dealing with? Are you dealing with diabetes? Are you dealing with I'm tired all the time, menopause, whatever it is, and then kind of working with them to uniquely for what they're coming to us for. But the Immune and Limitless, I think, are hands down the two I'd start with.
Or you picked the number 1 and 2 bestsellers, so there's a reason for that, right? So, start
Yep.
off with that immune system, your gut health. Core is
Or
moved heavily into very close to second best selling product. So, well,
yeah.
Tara, this is such a pleasure, such an honor, a blessing to be able to hang out with you today. And I know this is your first podcast too.
It's my first podcast, so
How was it?
it was great. It was
Well, I
great.
think it was great. You did fantastic.
Now you know about my dog,
Well, we didn't get the name of the dog.
Scrappy. His name's Scrappy.
I feel like that's the perfect name for the story that you just shared about Scrappy.
Totally. Every time I tell it, it's like people can't get over it. Yeah.
All right.
Those doctors
So Tara,
were amazed.
wow. I mean, I'm amazed. It was an incredible story. So Tara's a subscription for everybody here. No, that's what's the word? Whatever the term is. You're telling people it's time to get your dogs healthy with Alovéa and yourself. I love it. That's a good message.
Yeah, we can go market at all the dog veterinarians around town and see if they show them the pictures of Scrappy. Yep. I don't
Spend a
know.
lot of money. People spend a lot of money on their dogs, probably more than themselves. Maybe we should equal it out at least. So,
Think a
well,
lot.
Tara, it was
Yeah.
a great pleasure. Thank you very much. And for everybody listening, stay tuned for some new podcasts coming up shortly. So thank you very much, everyone.